All right, this is the Vital Signs video 4 on blood pressure, which is also abbreviated BP. Okay, so what is blood pressure? Blood pressure is the measurement of the pressure of the blood that the blood exerts on the walls of the arteries during various stages of the heart. Okay, so it is measured in millimeters of mercury, mm of Hg, using an instrument called a sphygmomanometer. Okay, say that with me. Sphygmomanometer. It's hard to say. And it's not like you will ever hear someone running through the hall saying, "Someone get me a sphygmomanometer." They will probably say, "I need a blood pressure cuff." But I do want you to know that the actual name is sphygmomanometer, and that is a blood pressure cuff. So this is an aneroid or a manual sphygmomanometer. I'm sure you have seen one of these and probably had one of these used on you. This is exactly what we will work with as we are taking manual blood pressures. This is a mercury sphygmomanometer. You may have seen one of these hanging on the wall of your doctor's office. And then again, you may not. These are kind of outdated, but just in case you ever had to use one, I wanted you to see a picture of it. A digital sphygmomanometer. This is one that would be for home use. You may have seen your parent or grandparent have something like these. They're pretty common. Actually, almost all insurances pay for people that have hypertension or high blood pressure to have one of these. Okay, so there are two types of blood pressure measurements that we write as a fraction. So the systolic, that is the top number, and the diastolic is the bottom number. As we talked about in our cardiac disorders unit, we had a blood pressure of 120 over 80 was normal, 130 over 80 was pre-hypertension, 140 over 90 was hypertension. So that was written as a fraction, okay? So now we're going to learn what those numbers actually mean. So systolic, this is the measurement of the pressure that occurs as the heart is contracting and pushing blood into the arteries. This is when the heart is at work or when it is pumping. Multiple times I have given you the example of our blood vessels being like a water balloon. Okay, so there is always pressure in that water balloon. But as the heart beats, or if you were squeezing a water balloon, okay, as it's pumping, there's going to be more pressure. Okay, so this is when the heart is at work or pumping. So a normal systolic reading is 120 or less. Okay, as you guys start to learn to take blood pressure, if you're 14 years old, I'm happy for yours to be 114, okay? It's like 100 plus your age. But it could also be in the 90s, okay? As long as it's not too low, then we're good with that, okay? But for an adult, a normal systolic reading is 120. But the range is 100 to 140, okay? So if it's less than 100, we usually say that is somewhat hypotensive. Hypo meaning lower than, HYPO. But I'm not really concerned unless it's less than 90. But your normal systolic reading, average of 120, the range is 100 to 140. Very important. Okay, diastolic. This is the measurement of the constant pressure in the walls of the arteries when the heart is at rest or between contractions. So picturing that water balloon again, this is the amount of pressure that is always in that water balloon, okay? It's always there. So this is why that lower number is more dangerous, because if the pressure gets higher and higher and higher always, then eventually that water balloon is going to break. And it's the same way for our arteries and our blood vessels. So a normal diastolic is 80 with a normal range between 60 to 90. But American Heart has made some changes in this. We really do want that number to be below 80 or below, okay? And this is at resting again. So if they just did 30 minutes of exercise, we're going to anticipate this being higher. So normal blood pressure for adults, 120/80. People with a history of heart problems or other diseases should aim for a lower blood pressure. This is why it is vitally important for everyone to keep a watch on their blood pressure. Remember, you've already learned that hypertension, high blood pressure, is the silent killer. There are no signs and symptoms. So there are blood pressure monitors at Walmart, at CVS, all over the place. It's just important for people to keep a watch on their blood pressure. Okay, so hypertension, you already know, is high blood pressure. This is a systolic greater than 140 and a diastolic greater than 90. Oh. If I'm going too fast, you can always pause the video. So what are some of the causes of hypertension? Stress, for sure. Anxiety. So if you are very, very anxious, you can anticipate your blood pressure being higher. Obesity is a cause of hypertension. A high salt intake. Aging. Can't do anything about that, okay? So stress and anxiety, we can try to control those. People with anxiety disorders have a harder time than that, but they can still work on that with medication and with self-management, managing our stress level. Obesity, we can work on. High salt intake, we can certainly work on. But aging, there's nothing we can do about. We are as old as we are. Thyroid problems can be a cause of hypertension. And then arteriosclerosis, or the hardening of the arteries. Remember, sclera means hardening. You've already learned this word. Okay, so just another. And then genetics, we learned that in our last unit. Genetics is certainly a cause of hypertension that we can't overcome. So what are some of the risks of hypertension? Stroke, kidney disease, and heart disease. Heart disease is the #1 cause of death in Alabama. It is actually the #1 cause of death worldwide. We will be having every year there is National Wear Red Day to bring awareness to heart disease. So in 2025, that will be on February 7th that we will wear red. If you remember to wear red that day, you get 5 bonus points. You'll also get 1 community service hour. We'll make some heart health awareness bags for our teachers just to promote heart health. So keep that in mind for February 7th. All right, so hypertension can be controlled with medication and or lifestyle changes. Those lifestyle changes may help control hypertension. A healthy diet, exercise. We talked about this in our last unit, or in the heart unit, that healthy diet and exercise are super important. Decreasing their salt intake and maintaining a healthy weight. Those are always great things to do to help control hypertension and just heart disease in general. And stress. So, speaking of stress, learning to control our stress level. And I know that you guys as teenagers, and to be honest, you guys have a lot more stress on you than I did when I was a teenager, or probably most of your parents did as a teenager, because there's just you guys just have a lot more. College was not in high school when I was in high school. A lot of you guys are taking dual credit classes, or you will take dual credit classes. And then you also have sports, and you have maybe band or just other athletics. A lot of you guys are working jobs. That's a lot to manage. So learning to control your stress level is really important. Not to mention that y'all have social media on top of everything, which is a form of stress. Depending on your individual situation, you may have family situations, relationship situations. All of those play into your stress level. So how can you control that? Just a few tips. Having healthy relationships. You may not be able to control your family relationships, whether they're healthy or not, but surrounding yourself with healthy relationships, people that are healthy, people that build you up instead of tearing you down. That is really important. It's going to be important for the rest of your life in controlling your stress level. Downtime. Downtime is not you laying down in your bed looking at your phone. Downtime is true downtime, that you are doing something that you enjoy, or just giving your brain a break. Okay, exercising. It could be doing nothing, but it could be watching Netflix. But if you're on your phone and other people, or you're looking at social media, that is not downtime. And I'm not just making this up. There's tons of studies that have proven that being on your phone with social media is certainly not downtime. It keeps your brain in an engaged time, okay? And so you just have to be really careful with that. Good sleep patterns. So going to sleep at the same time, waking up at the same time. I know that sounds terribly boring, and maybe it is, but it is good for your stress level. And seeking help when needed. I can't figure out how to move this little thing right here, so but seeking help when needed. So if these are things that you're struggling with, controlling your stress level, that's a time to talk to a trusted adult or a counselor. You can always go to your guidance counselor. I'm certainly available to talk to you if you're having some issues controlling your stress level, but definitely seeking help when needed. These are ways to maintain a healthy lifestyle. You already know hypertension is called the silent killer. There's no signs or symptoms, but it can absolutely lead to death. Okay, hypotension. This is not something that we've talked about. So this is low blood pressure. So this is going to be a systolic less than 100 and a diastolic less than 60. Now, when y'all start taking blood pressure, which will most likely be next week, some of you may have a systolic less than 100. A lot of you are still considered pediatric, and so that's totally fine, okay? The biggest thing is going to be if they're symptomatic, if they are faint, or feeling like they're going to pass out, those kind of things, symptoms of hypotension. But that may be your normal. So what are some of our causes of hypotension? Dehydration is a big cause of hypotension, especially in the summer months with people, especially when it's so hot, if they're outside exercising or at football practice or cheer practice or band camp or whatever, getting dehydrated, that can certainly cause low blood pressure. Depression can cause low blood pressure. Long-term depression it absolutely has a physical effect and can lower their blood pressure. Shock. Okay, so after we finish vital signs, we are going to do an exciting unit on first aid and disaster first aid. So if someone is losing blood and going into shock, that can be a cause of hypotension. Hemorrhage, again, if they're hemorrhaging, we can anticipate and heading into shock, that can be a cause of hypotension. Heart failure, we've already discussed heart failure in the cardiac unit. They can certainly have low blood pressure. And then probably one of the biggest reasons for hypotension is a position change. This is called orthostatic hypotension. I bet you have all experienced this if you go from a sitting to a standing position really quickly, or if your alarm goes off, or if you wake up suddenly and because you're late and you see stars when you jump up, you have just experienced orthostatic hypotension. This is just where you get up too quickly, and because your blood vessels didn't have a chance to compensate, that your blood pressure will drop momentarily. This can be a reason that patients could pass out, or that you could pass out. So that's why we have to do position changes kind of slowly. Okay, if you remember when we were moving patients from the wheelchair to the chair, we had them sit on the side of the bed or sit on the side. Sit at the wheelchair for a second, make sure they don't feel faint or anything, and then we moved them from one position to the other. That's to cut down on orthostatic hypotension. Okay, so this is what I just said occurs when there's a sudden drop in both systolic and diastolic when a person moves from a lying to a sitting or a standing position, caused by those blood vessels not being able to compensate quickly to the change in position. The person may feel lightheaded, dizzy, they might have blurred vision, and they could possibly faint. So this is a reason that we'll have them sit on the side of the bed and say, okay, you feel okay? You feel dizzy? All right, now let's go from the bed to the wheelchair, or the wheelchair to the chair, just to give their blood vessels time to compensate for that change in position. Okay, so factors to consider when measuring blood pressure, which we are getting to. The cuff has to be the right size. If it's too tight or too large, you are not going to get an accurate reading. In a perfect world, the person would sit quietly for 3 to 5 minutes before the blood pressure is checked. But I want you to think about when you go to the urgent care or the pediatrician or wherever you go to the doctor. Do they bring you back and say, okay, Miss Price, we want you to sit right here for 3 to 5 minutes quietly and take some deep breaths, and then we'll come back and take your blood pressure? No, it's not what we do. We herd people in like cattle and say, sit here, and then we slap the cuff on them and we take their blood pressure, and while it's taken, we say, why are you here today? And so we may get a higher reading than what their normal is, okay? But if you get a high reading, you should say, okay, all right, let's let you sit quietly for 3 to 5 minutes and then take it again. So we are going to stop right here, and in our next time together, we will work on taking blood pressure and learning how to do that. This is the end of video 4.